Hey there, we are going live. It's the Chelsea and Julie show. We were just laughing that it's very rare we actually get to do this in person. So we're in our Torn studio today, and we are talking all about our functional neurologic disorders program. We've gotten a lot of questions because we share stories all of the time, and we get a lot of questions on what is our program, what do we do, where are we, is it inpatient, outpatient, how can we serve, how do we serve people in different states or countries and all of that. So we're answering your questions. And if you're here live and have questions, go ahead and put them in the comments and ask away. We are happy to answer your questions. But I have to introduce Chelsea. So I know I'm normally on the lives. My name is Julie Hirschberg. I'm a neurologic physical therapist and the owner and founder of re+active. Chelsea wins the prize for probably the most swag that we have. But Chelsea is our functional neurologic disorders program director, meaning she does the consultations for people when they're looking to come for a program. She guides all of us in best practices for FND. She meets with patients. She treats with our team. She leads our integrated teams for working with people. And she's actually going to be at the FND Society meeting in Italy in June, presenting one of our posters for our team to share about what we're doing. So she does a lot.
Thank you for that wonderful introduction.
But maybe first, people just want to know, what is our program? Let's start with that.
Yeah, great question. So we have an integrated, interdisciplinary, really it's transdisciplinary. All of our teams are working very closely with one another. Program for people with functional neurological disorders. It's an outpatient program. We have 2 outpatient facilities in Los Angeles. And it's very unique. I think the thing I love the most about re+active is that we're able to take all of the evidence out there that is best practice for working with individuals with FND and individualize it. We really value individualized care and specializing our approach to the person that we meet. So our programs are not a cookie cutter, like everybody gets the same program, but typically our programs are about 4 to 6 weeks in duration. There's usually about 2 to 3 hours of therapy a day, and that is individualized. So we actually do consultations with individuals and families who have FND, and we create their pie chart with them in these consults where we ask more questions about their symptoms. We get to know them and their goals. They help us drive their team and what is the best fit for them. And then we also talk to them about what's possible. A lot of families can't do 4 to 6 weeks, so we meet them where they are. So it's really a collaborative process to create a program that's best fit for each individual. But on average, 4 to 6 weeks, 2 to 3 hours of therapy a day, 5 days a week. And we're very tool oriented. So our team is focused on your goals to help you achieve them. And we attack those goals from different lenses, but all with you in mind. You're at the center of the pie. At the end of it, we create a discharge summary that is really all of the tools that we've found to be helpful for someone with their functional neurological disorder to empower their agency and control over their movement, symptoms, whatever their FND presentation is. So that's just a little bit about our FND program, just kind of like bird's eye view. It's been a blessing to be a part of these programs. We've really grown over the last 8 years. It's just been really fantastic to be a part of these programs.
Yeah. And you mentioned the pie chart, and I recognize I talk about the pie chart a lot, but people might be joining us and be like, what do you mean I'm the center of the pie? What does that mean? But I do think this is a little bit of our
Special sauce.
Special sauce is that, and this is part of the poster that we're presenting, is actually presenting this pie chart method.
Yeah, like a framework.
It's a framework taking on all of the evidence that we have, the neuroscience, especially in understanding FND, and maybe you can talk about how the team works to actually understand what pieces of the pie are underlying a person's symptoms.
Yeah.
And then how they work together. And I see some questions coming in too, so we'll get those too.
Yeah.
But yeah, great. Give us a pie intro.
Yeah, so it starts with that initial consultation, just hearing someone's story. So a lot of what I try to do when I'm meeting individuals with FND is ask further questions that might lead me towards different areas of their clinical picture. And like Julie said, we've created this pie chart that has to do with the pathophysiology of FND and what can either be underlying, what can also be contributing to someone's FND and perpetuating the ongoing symptoms. So those include psychological and social factors, lifestyle factors, autonomic nervous system contributing factors, physical limitations. There's people who have bones and joints, and those could be contributing just as much as the nervous system, and then motor and sensory control. And so we'll start talking about, say autonomic, for example. Maybe we'll talk about heart rate regulation. So the autonomic nervous system controls our heart rate and our blood pressure. It controls our GI system. So if someone in their story is saying my heart rate skyrockets when I stand up, I'm immediately thinking there might be some autonomic nervous system contributing factors to their FND. So we start in that very first consultation asking questions to get a little bit of an understanding of what aspects of someone's pie are a part of the picture. Now, obviously, we can't do these assessments right away, but once somebody comes, we go a little bit more in depth throughout the whole team to assess and treat those factors. So we have, objective tests that we can do in person for the autonomic nervous system, for the sensory processing system, for how someone's motor control is performing, psychosocial contributing factors, even cognitive, brain fog. We have neuropsychologists who can conduct some screeners to really understand what is coming up for somebody and what is contributing to their symptoms. And then we all kind of talk about how each discipline can address that. So we could take lifestyle, for example. So say somebody's having some difficulty sleeping because of pain in their FND or movements in their FND. We could all be working on that goal of improving sleep, but OT might be working on a sleep routine. They might work on a sleep compression schedule. They might work on a wind down routine. Physical therapy might be trying to understand what with the sensory processing might be contributing to the pain. And then psychologically, the thoughts and feelings and emotions that come up with trying to go to sleep, and how are you relating to your sleep? What kind of support are you getting for your sleep? So we all are addressing the same goals, but from a slightly different lens. So that's kind of how we address the pie chart. And we include the client in this discussion, and we show them, does this fit? Do you feel like this makes sense? A lot of people ask for their pie charts. They get it throughout their program. And the pie chart changes as we treat things, right? So say someone has some sensory processing challenges. If we treat that in physical therapy, by the end of their program, that might be better. And so that slice of their pie might go down. So I like to think of FND as like an onion, and we're kind of peeling back the layers that are contributing to someone's overall picture.
Yeah, that is great. I'm going to grab some questions that have come in, and somebody sent me a question too, wondering about can we work with people from out of state or other countries? And I know there's laws that limit these things, so maybe you can talk about all the different ways people can work with us, and then I'll get to some of these questions.
Yeah, that's great. So right now, our physical therapy, the full team, physical therapy, occupational therapy, psychology, and wellness, those integrated programs that we've been talking about so far, those do have to take place in person in California. We can treat physical therapy and occupational therapy internationally. Psychology, unfortunately, cannot right now, but we cannot treat outside of the state of California in physical therapy and occupational therapy. Really, it's the other states that kind of bar us from doing that. If somebody is wanting a full integrated program, typically people come to Los Angeles and do those with us. But that's not possible for everyone. So Julie and I have been brainstorming for like a year or so about other ways that we can support individuals through like a wellness service. So that's when we developed the FND community and membership. So it is a membership and education community for individuals with FND, and that is accessible for anyone in any state worldwide. It's virtual, it's recorded, and those include exercise classes that are specific for people with FND, mind-body classes. We even have been doing a POTS exercise class, which has been really fantastic. Weekly education classes taught by our movement disorders fellow who's in the literature talking about FND, talking about the pie chart. It also includes this community of individuals with FND who can support one another. And I think that's been like the coolest part of this membership, has been seeing the support that these individuals provide one another all over the world. It's a way to create some support and community.
And we get to be in there too, which is great. People can ask us questions, PT, OT, psychology, all in that group. So that has literally just launched this year, right? So we have been really excited to have an international group of folks. So if you are out of state and can't travel to us, that is a really great option. Someone else asked me, do you have a list of other providers? So I'll share a link in our stories, but we have an amazing group of clinicians in a membership called Brain Bites, and we publish a directory. These are people that have committed to a full year of learning, growing, mentoring with our team. So heavy on the FND. So I'll share a link to that as well. And we do have people that join us via telehealth. So let's say they live in a remote part of California, we might do telehealth services, and we can do telehealth PT, OT, and psychology as well.
And one of my favorite things has been recently, physical therapists and, providers have reached out to me to do virtual support for them while they're working with their clients. So we can actually consult with your providers. Mm-hmm. We're not treating you out of the state, but we're consulting and mentoring your provider to be able to support them in treating you and supporting individuals with FND. So that's been really fun. We've done Canada and, all over the world. So it's been really cool to be able to support clinicians.
Yeah, that's a great way. So Alex is asking, have the majority of your clients received a lot of other services before they find us? I wish it wasn't the case, right?
Yeah, I think, yes, unfortunately. Yeah. I mean, the mean time to getting even diagnosed with FND is about 6 years. It's pretty astonishing. I think that's getting better. I think over the last 10 years, both neurology and movement disorder specialists have really honed in on their ability to accurately assess and diagnose FND. But yeah, I think a lot of the people we meet have been through treatment. They've been, I think kind of traumatized by the medical system. And honestly, I think one of the benefits of working with our psychology team is that it's a healing medical environment. I think we're not very medical. We're more holistic, but I think that's the power of having psychologically and trauma-informed therapy, whether it's PT, OT, and psychology. But it can be really healing because so many people have seen providers who have told them this is all in your head, you're making it up, it's fake, which is just not true. So yes, people have seen a lot of therapies, and I think what I tend to tell people why it might not have been as successful is that it might have only been addressing one slice of the pie, right? So maybe you went to a physical therapist who was able to treat your tissue issues, but if we know that FND has to do with how the brain networks are communicating, it's going to be much more than just treating the tissues themselves. So it might be why you didn't get a lot of benefit from one individual service, and that's why the literature really shows that these kind of transdisciplinary, holistic approaches to treating FND are most successful.
Yeah, that's great. This is a good question and common when there's multiple competing diagnoses. So this person said, I have one doctor who says I have dystonia, another one who says I have FND. Who makes the determination which program I should follow? This is the beauty of the pie chart, I will say.
Yeah. I think the pie chart does help. The great thing about both dystonia and FND is that there's positive signs and symptoms for each. There's things that we as providers can do to kind of suss out what is contributing to your movements. The challenge is that you could have both, right? Most individuals with neurologic condition, there's a high percentage that have kind of FND and dystonia, or FND and Parkinson's, for example. So it's finding a clinician who can help you understand which aspects of your symptoms are coming from which diagnosis. So I might actually go to your neurologist or go to your movement disorder specialist and ask those questions. Say, if you think part of this is dystonia, what percentage might be functional neurological disorder, what percentage might be coming from my dystonia, because there will be a different treatment approach for each. Dystonia might have some Botox injections or some, medical management. FND, they might take a different approach. So, I think it's not easy, but there are ways for clinicians, skilled clinicians who understand these conditions, both neurologists, movement disorder specialists, and physical therapists, occupational therapists, clinical psychologists, who can help you determine what is what, and it might be both, and that's okay.
Yeah. And I think I don't know that I've ever met a person with FND that didn't have several other things. And I think that's probably the more common presentation is that a person also has migraine.
Yeah.
And we need to treat that too. That's not FND. And they have hypermobility and we need to address that. And they have POTS or dysautonomia and we need to address that component as well. They have mast cell activation syndrome. Like we see multiple overlapping diagnoses and we can treat all of the things. And I don't even like saying treat all of the things. I think it's really the person that's the most important, but you can consider all of the diagnoses at once.
Yeah.
Other questions that have come up literally this week to me, even when I was doing consultations, were what are some of the outcomes? And we've actually put together a couple of resources which we can share with anybody. Just send me a comment. We have a little research resource that has all of our abstracts and presentations, so you can see that. And we collect a lot of data. We collect a lot of outcomes. So most people really want to know, how much do people get better?
Yeah. And we use, one of our main outcome measures that we use is called the Patient Global Impression of Change. We use that and the Clinician Global Impression of Change. And this has been studied in a lot of healthcare settings. It's valid and reliable. And it's a 0 to 7 point scale. And really anything 6, 7 is like a definite improvement that somebody is very meaningful difference in their life. And about 75% of our participants in our FND program rate a 6 or a 7. So, and like I said at the beginning, our FND programs are not cookie cutter, right? Not everybody's getting the exact same treatment, the exact same duration. So I think this shows the benefit of that individualized pie chart approach, that we can tailor it to an individual and still see really significant outcomes. We also use an outcome measure that's called the patient-specific functional scale, and this one's great because individuals identify activities that they're struggling with and they rate them on a scale, and we're able to show change over the duration of the program. And so A lower score means that people have more difficulty with activities. So on average, most of our FND programs started around 30% confidence, a lot of difficulty in their daily activities. And we usually see that there's at least 60 to 70% at the end of an FND program. So that means that they're significantly improved in their ability to perform their daily activities. And, in this area of outcome measure, a change of about 2 points, a little over 2 points, is significant. So we can actually show this isn't just random, like this is actual change that people are experiencing. And I always tell people, I wish I could look into a crystal ball and predict exactly what's going to happen for individuals, but I know for a fact that everyone who goes through our FND program comes away with a toolkit, comes away with a set of, strategies to be able to help them engage in life again. And that's really a core focus of our program.
Mm-hmm. I think people will ask, well, is it 100% recovery, right? And well, it's no guarantee. I don't think anybody would guarantee that for any disorder at any time. You could tear your ACL and nobody's going to guarantee 100% recovery. So we see a wide spectrum, right? We do see people that don't have any symptoms anymore. You've heard them interviewed here. And we see other people that are still struggling with symptoms. And there are some prognostic indicators even in the literature that seem pretty consistent here at Reactive. So we try to give people a pretty realistic picture, but we don't have a crystal ball.
Yeah.
It's hard. It's really hard to do.
It is, yeah.
I'm going through some other questions here. Talking about, so some people want to know about the team approach and particularly what are why PT, why OT, why psychology, why we might include yoga therapy. Yeah. I know that's a lot. We could probably talk for a whole hour on that, but maybe you could talk about those particulars.
Yeah. Well, I think, I'll start with OT because I think our OT team is very unique. And when I talk to individuals on our consultations, our OTs are lifestyle specialists. So as soon as somebody is talking about difficulty with sleep, pacing, fatigue, daily routines, engaging in self-care in any way, I know that OT would be beneficial for them. They are lifestyle specialists, and they're going to take a very individualized approach to treating your lifestyle challenges, but I think it can be a really fantastic way to build supports to get back to life. So that's kind of the OT aspect. Our physical therapists, of course, we can treat tissue issues, but all of us are a little bit more in-depth trained around, I would say a lot actually, around how the nervous system functions, right? And so our goal is to understand how the motor system and the sensory system are processing and how that informs our ability to create the movements that we want. So they might be focusing on how the tissues and the sensory processing is influencing the nervous system. We can treat the autonomic nervous system. We can treat, the tissues themselves. So physical therapy is much more than just the physical side, but it's how our brain is perceiving the world around us is kind of how I would describe our physical therapy approach. And then, psychotherapy is just, I think, the greatest support. And like I said earlier, I think it's helpful for, coping strategies and support around previous medical trauma. So many people have had providers that have really been invalidating. So being with a provider who understands FND, who is going to support you and validate you, and who is going to provide you with, coping and resiliency tools to be able to engage in life again. And it's a very individualized approach. They don't take one CBT approach or acceptance commitment therapy. It's very much a mixture of approaches based on the individual needs. And they're not trauma therapists, but they're trauma informed. And so I think, if someone's FND is a part of, a trauma history, or if there's a trauma history that's contributing, our psychologists can be really helpful in finding additional resources for them as well. And then yoga therapy, I think, is another special sauce of reactive. I think that it's a space where people can practice the autonomic regulation tools and have a positive association with movement and regulating their nervous system. So it's a way of restoring agency over their body, connecting to their body in a positive way. And it's definitely not like a yoga flow, like a class, like a power yoga class. It's, an individual who is meeting you where you're at and really understanding what the nervous system might need in terms of regulation. So those are kind of the pieces of our team.
Yeah. And we have a lot of secret sauces. That whole team gets together every single week to just talk about that particular person. And how those pieces come together are usually quite magical in my mind, but we help each other figure things out. Mm-hmm. And I know we're running out of time here, but maybe one last thing is, what is the process? Because we're not a traditional clinic, and it's not just like, well, come in for an evaluation. We actually have a process to get folks in. And so maybe just talking through that. And then, of course, send us questions. We'll be happy to answer them later too.
Yeah, so typically when someone finds us, we send them to our website where we have our application. Our application is the perfect place to start. We start to learn a little bit more about you as an individual, your goals, and what you're looking for in terms of treatment. And then we, from there, are able to set up an initial consultation. Typically that's via Zoom, so that we can meet with you one-on-one to understand a little bit more about you and create the program that's best fit for you. Once we create the program, then we create, what this would look like. We work with you on time frame and scheduling and all of that. And then we can move into someone actually coming to California for treatment. And in that consultation, we can also talk about all of the out-of-state resources and additional support systems that could be for people internationally or out of state or whatever. It's not a traditional call up, get a schedule, because if we're creating a full team, we really want to make it integrated, and scheduling really depends on how we can kind of create the best support for an individual. So we might be scheduling a month out or so because individuals need that, integrated care that we're looking for.
Yeah, that's great. People do ask about our wait list, and it varies.
It does.
Quite a bit. So it could be like we could get you in next month, or it's happening in 3 or 4 months. And we do have 6 different teams going all of the time. I think we were saying how many per month?
Yeah, I think it varies, but anywhere from 8 to 16 programs running per month. Between our 2 locations, which is really fantastic. And we've really grown. We started these in 2017? So it's really grown from one team, one clinic to now 2 teams and lots of programs. And we have more capacity to grow in these areas. So we're excited to work with individuals who are ready.
Yeah. Awesome. Well, thank you for joining us live. This was a fun one to talk about our program, to answer a lot of questions. And again, send us a message if you have questions. And yes, we are accepting internships. Somebody is asking.
Cool.
So we do take Doctor of Physical Therapy students, and we have OT students that are here. And then if we also have a volunteer internship for people who are looking to get into health professions. So you can check out on our website at reactivept.com. Awesome. Thank you so much. Thank you, Chelsea.
Yeah, no problem.
It was fun. And we'll see you all again soon.
Bye.
Bye.